Thank you, Madam Speaker. Minister, welcome to the Senate. It's good to see you again. I want to talk about pediatric ICUs, pediatric care. Fall and winter of 2022, pediatric ICUs across this country were operating well above capacity. Sick kids at 120% capacity. Children's Ottawa, 124%. Children's Healthcare Canada, the Canadian Pediatric Society, the Canadian Association of Pediatric Nurses called on governments then to move beyond jurisdictional constraints and to work collaboratively to develop a new vision for child and youth health care. A call to action in 2022. Minister, what concrete national plan for pediatric health care has the Government of Canada put in place to ensure that Canada's children, youth, and our pediatric health care systems are never in that position again?
Madame la Ministre.
Thank you, Senator, for your question. As you know, I think sick kids and other hospitals taking care of kids here in the country are doing a fantastic job. I just was at Sitkidla 2 weeks ago, I think. Honestly, I don't have the answer right now because I don't know what was specifically done from 2022, but I will get back to you after this meeting on where we are at. But what I have to say, and this is a conversation I will need to have with my counterpart, not tomorrow because we already have the schedule, but very soon. I think we need to work more on prevention altogether. And working with the newborns and young people is absolutely fundamental. And I think this is where we would have to address some of the challenges that you just raised.
Senator Moody.
Thank you, Minister. The United Kingdom has a national children and youth people's health strategy. Australia has one, but Canada, one of the wealthiest countries in the world, does not. Without a dedicated national strategy, children and youth will continue to fall through the cracks of the system designed primarily around adults. Without a current national child and health strategy, how is the government ensuring that children and youth in our country remain healthy?
Madame la Ministre.
Well, as I said, I don't have in my plan right now. I don't have I'm not working right now on the strategy, but I agree it's something we need to address, and I will also speak with, because when I decided to bring forward with my men and boys health strategy, I went to my counterparts and I asked them, this is what I see on the ground, what can we do about it? And everyone was supportive. So I think this is a conversation I will need to bring with provinces and territories, as they are the one dealing with the services. So for just me, the federal government, to say I'm moving on this, it won't serve.